Hello, everyone. Welcome you all to another exciting sharing with Kopi with Vance. This is your host, Vance here. It is so good to see a lot of people are just coming in, tuning in. Thank you so much. I'm sure today is going to be a very exciting and a very informative segment in the house that will definitely will interest you. Yes, that is the topic of breast cancer myth. All right, before that, I would like to introduce my guest speaker, Dr. Chan, practices at Orchard Mount Elizabeth Clinic as a senior consultant. Dr. Ching Wan has a special interest in the formation of cancer and how it can be inhibited and treated. Dr. Chan is also an assistant professor at the Yong Lin School of Medicine, NUS, since 2009. Prior to being an essential part of Solis, she was the Colster subspecialty lead for breast services in Singapore's National University Health System. Dr. Chan was also the tumor program lead for the breast oncology for National Cancer Institute. So, without further ado, I'm going to invite Dr. Chan on board at Kopi Events. Dr. Chan, hello, Dr. Chan.
Hi, good evening.
Good evening to you. Thank you so much for allocating your precious time and joining me live at Kopi with Vance, Dr. Chan.
No, it's always good to get in touch with people, and I guess now, especially with COVID, it's harder to connect. And I think what you're doing here is a really fantastic job. So
Thank you.
thanks for
But
inviting me
definitely,
for.
but definitely, we're having coffee over virtually, so that is a new thing right now. So I'm not sure if you're drinking coffee. So yes, thank you, Dr. Chan. And Dr. Chan, before we even dive into the topic, I would love our viewers and myself would love to know a little bit more about you. Of course, I did a little introduction on that, but why you want to be a breast on plastic surgeon that you choose to, and instead of different varieties of other health specialization you can go to. Maybe we can start with that, Dr. Chan.
Um, I don't know. I think it was just a gradual progression because I always wanted to be a surgeon. I enjoy operating, and it sounds a bit morbid, like cutting people up and things like that. But even before medical school, that was what was my interest. And so after I graduated, um, I went through my basic training. I did take a break halfway through training to do some research, and that actually was in breast cancer. And I think that's where my interest in cancer started. Um, Towards the end of my training, I think the way breast oncoplastics is, I was very fortunate because just when I finished my advanced training, that's when that particular specialty started to get really popular. In the past, for women, if you had a cancer, you take away the whole breast. Trying to save the breast was not so common, and it was quite tricky to do, especially for Asians because we are generally smaller sized. We don't have so much tissue that you can move around, and so leaving a normal looking breast actually was more difficult. And so I just went away to the UK. I did 1 year, 9 months there. But my boss there was really inspirational, and he was one of the key figures in trying to help women save their breasts but still cure the cancer. And I've always enjoyed it. And actually, after that time there, I've really enjoyed my work, which
All right.
is good because, yeah, I can help and I still enjoy it, which is a bonus.
So it never office day or is it not a hospital day for you? It's something like it as if like you're breathing in and breathing out. It just become a part of you in every part of your cell as well. So glad to hear that, doc. I mean, if everyone have that kind of passion and that kind of energy within them, that they never treat that as an office or work or whatever. I think every day everyone enjoy in whatever they do. Thank you for that, doc. Doc, let's jump into the topic itself. We do hear a lot of cases about the lung. We hear about the all the other part of the body. We even covered a topic just about 2 weeks back,
Mhm.
pancreatic cancer as well. But can you please tell us something about these breast cancer stats in Singapore or even the globe as well?
Okay, I guess in Singapore, breast cancer is a cancer that mainly affects women. Out of every 12 women in Singapore, one of them will get a cancer. So I guess if you count the numbers, it isn't so common, but it is certainly common enough that nowadays, because our families are still relatively big, it's relatively common that most families would have one member of the family have cancer, or certainly within their own social circle, friends, um, who would also have been affected by cancer. So it's something that actually touches many people in society directly and indirectly. Mm.
And how about the numbers in Singapore, doc? I mean, of course,
Oh,
we're not going with the accurate numbers, but if you're looking at the cases, I mean, is there a comparison? We talk about? Are we
yeah.
talking about?
I guess it used to be a lot lower. We do see the number of cancers going up, unfortunately, and we suspect that it's related to the fact that our lifestyle is becoming increasingly westernized, especially the diet, but also part of the environment. I think about 30 years ago, it was the statistics was 1 in 15 women would get it, but now it's crept up to 1 in 12. In places like Europe and the US, it is 1 in 8. Fortunately, our diet is nowhere near that of the West because we still have a very Oriental diet and a lot of Asian diets. So the the Malay culture and the Indian culture each have their own particular foods, and I think each of us in our race we do still enjoy
That's
our
right.
own cultural food, and so we
That's
don't
right.
eat so much of a Western diet as the West does. See,
Yep.
so I think
That's true.
that does mitigate it a little bit. But because we are increasingly westernized, I mean, look, Burger King, McDonald's, all the burger joints everywhere. It is so easy to get one. So that is part of it. Yeah.
And nowadays, if you look at it, all the delicious food are always fried, and
Yes.
everything is surrounded by food, right? I mean, we can't complain.
Yes.
We all Singaporeans, we love food, but unfortunately, yes, processed stuff and all that, they have their side effects as well. But
Mm.
thanks, doc, for that on the stats as well. What are the symptoms or signs? I know you have prepared more than required number of slides, which I was very puzzled and thankful. I think over 60 over slides.
No, 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 not
Wow.
that many.
Okay, about 40.
Yeah.
That's right. So 40 slides. I mean, it's really going to be informative. So I'm not sure which one to cut it off, but honestly, it's going to be a full training. Everybody's going to walk up today. They're going
It's
to lock off.
okay.
They're going to
We just
hear
see what you can
something from
get
that.
through.
All right. Do you think that we should jump into the slides instead of me asking you that question? Because I know that the slides that you have, it's going to cover the whole spectrum of it. And I would love the viewers
Sure.
to see that as well. So, Dr. Chan, please,
Okay.
your slides, please.
Uh,
All right, for all the viewers who are tuning in, please give us thumbs up and like, or thumbs up and like the same. All right, and comment if you have any questions, because I'm sure we have the last 10-15 minutes for Dr. Chan to give some questions, Q&A time. And we also have another guest who's coming in. She's a speaker. She's going to speak on our experiences. She's such a lovely and dynamic lady that she's going to come in a while. And I'm sure most of y'all will be wondering who she is. It's going to be a surprise. But right now, we're going to see the slides right now, which Dr. Chan has prepared. Dr. Chan, it's all yours.
okay. So I just thought it'd be quite good to go through some misconceptions about breast cancer and also go through some facts so that everyone who listens in has a better idea of what this condition is. So, if we just start at the very beginning, this is just a basic diagram about what the structure of the breast is. So, under the skin, you can see that this is the center and this is where the nipple is, and you have ducts going into the center. And this is
Mhm.
ducts that actually you can see the little pockets of tissue. Those are actually your milk lobules, we call them, but they're little pouches, and the milk forms in them, and then they drain through the ducts, come out through the nipple. Okay, most cancers tend to arise in that particular unit. So the lobule that becomes the duct, that's what we call 1 unit of breast tissue, and the cancer cells usually arise from that. Um, so if you look at the top of the slide on the left, that is what a normal breast duct lobule looks like in a cross section. When the cells get overactive and then they form a thicker layer, that's when they actually become what we call hyperplastic. That means they overgrow. And as time goes by, especially if there are a lot of mutations within these cells, which is part of the reason why they go into overdrive and then they never stop growing. And then you see the bottom picture where they actually have grown beyond the boundaries of the duct. And this is when a cancer is defined, because cancer cells are abnormal cells, but the abnormality is not just in the cellular structure, but it's also in their ability to invade beyond where they start. And once they invade out, they then enter either your blood vessels or they go into other channels that the body has. And this allows them to then travel out of where they started, which would be the breast, and then go to various parts of the body. Okay.
Right.
But let's go on to what it is. So, breast cancer is very common. It is fairly common. I think now, like I said, many women know at least someone or have heard of someone close who has had breast cancer. But currently in Southeast Asia, it isn't that high. It's 1 in 12. But if we're not careful, it can go up to the statistics that we see in the US, so 1 in 8. A lot of women think that this only happens at a certain time or a certain age, and then you feel that, oh, when I'm very young, it cannot happen, or when I'm very old, it doesn't happen. But no, although it is more common after the menopause, women before the menopause can get breast cancer, and young women can get breast cancer. I think my youngest patient was just out 20. Fortunately, it's extremely rare. However, it just pays to be aware so that if something unusual is happening, you get it checked out and we know it's nothing dangerous, and then that's great. But if it was, at least we find it and we can get on top of it early as well. And so, yes, unfortunately, there are no age groups that are spared, unless, of course, yes, in your teens. I've not seen one in the really, really young. So the first 2 decades of your life, you're probably safe. But after that, it starts to go up in.
But Dr. Chan, okay, the age is just here, but the commonly it's about 40, 45 and above. Is that more
The
higher
commonest
side?
actually, yeah, the commonest is actually between, especially in Singapore, we see it 45 to 60. That's the commonest band that it happens. But before that and after that, we do see the cancers happening. Although if you look at the facts, actually, the older you are, the higher your risk. In the past, this didn't happen we didn't see it so much because in the past we didn't live so long. But now we all know we are living longer and longer. Now we are thinking
Yeah.
whether we should all live to 100 years old, and then, well, yes, when you start seeing that, your breast cancer risk goes up. Yeah. Okay. This is the third one. Only women get breast cancer. More or less, yes, but unfortunately, men do get it. So for every 1,000 in women, I think I told you 200, but it's actually I was
Yeah.
wrong. It's actually for
Okay.
every 1,000 cancers in
Okay.
women
Yeah.
is one man. So yeah, a lot fewer. But in men, if you do get a breast cancer, it actually means that there may be a genetic mutation. It's almost always due to that. And so then, actually, your children can be affected. Your family, your sisters, and even your parents may also be affected. And so then we actually go into a different set of investigations in order to try and trace whether there are other family members who also may be likewise have that mutation.
Mhm.
Okay. And most men do find it as a lump as well, which is what most ladies find. Uh, because it isn't so common in men, we don't ask them to go for screening. But for women, what we normally advocate is that you should come for screening regularly because we want to find them before they are big enough for you to feel. All right. Okay. But the commonest way you find a breast cancer, if you were to find it yourself, is that you would find a lump in the breast. The good thing is not all lumps are cancers. In fact, most lumps are not cancers. But we do need to check them, make sure that they're not a cancer, and then we'll send you on your way and you can go back to your life as normal. But like I said, if we do find that it is a problem, we hope that we found it early enough so that we can control it so that it doesn't affect you anymore and you can go back to life as normal as well. Okay. And
Doc,
so,
just going to
hmm,
ask you a question here.
yeah,
I mean, I know
yeah,
we talked about this. I think it's quite relevant here. What defines a woman is, of course, the beauty, the motherhood, and of course, a certain part of a body part
absolutely.
is very important, especially the
Yeah,
breast as well. But
yeah.
when you compare this to 30 years back or 40 years back, and versus right now, we are at 2021, going to be 2022. You mentioned that is now is way much more the higher chances to save the particular tissue or the breast. Um, in most cases, of course, we can't have an exact number, but what will the percentage be, or what we can say that more breasts can be saved compared to what it was about 40, 50 years back?
Okay. By and large, actually, being able to save the breast depends on how big the cancer is, because that determines how much tissue has to be removed, and that needs to be against how big the breast is. So if you have a big cancer, small breast, then pretty much most of the breast has to go. If you have a big breast and you have a very small cancer, just taking out that little space probably will not even affect the overall appearance of the breast. What my specialty does is that we try and push the boundaries to allow people to save their breasts if they want to. It is still a choice. So some women do choose to remove everything because they feel there are certain advantages for them. And so it's not completely a wrong way to go. But certainly, what I try and my specialty is that we have different methods, techniques to either rearrange the breast tissue, or we actually recruit tissue from somewhere else and use it to fill up the hole that we make. And so you are still able to have a normal looking breast, although there will be a scar from the operation.
Thank you, Doc.
Okay. Yeah, a lot of ladies think that breast cancer is painful. And so you feel a lump is not painful. I've had so many ladies come and say, I'm not worried, it's not painful. And actually, that's the one that you should worry about. If breast cancer was painful, it would be a lot easier to find. And most women would not come late. But no, when the cancer starts in the breast, it starts when the body is already fairly mature. It doesn't have enough supply. So itself, it has no feeling. So most of the time when you have a cancer and then it actually causes pain, it is fairly advanced because it means it's actually grown into the tissue around it. It may be eating into some of the nerves, and that's why it's irritating them, and then you get some sensation. All right. There are some women who do have a little bit of pain, but on the whole, most cancer isn't painful. So you should not tell yourself, oh, it's not painful, I don't have to worry about it. Although, yeah, many people feel that, oh, cancer is, it's fatal. You can't stop it. If it comes, then I'll just give up and, let nature takes its course. But actually, given the amount of research and studies that have gone into this condition, because it is a very common condition, and so a lot of work has been done in it. Breast cancer can be prevented if you keep your weight down, if you reduce your alcohol intake, and if you exercise regularly. All of this actually boosts your body's health, but for some reason, it also does protect you against breast cancer. And so these are
Is,
actually very good things to do.
is there any other presentations, doctor? I mean, smoking, of course, is definitely one, which is,
Smoking is probably
yeah,
the smallest factor that can cause breast cancer. Actually, out of all the various factors that we studied, smoking, okay, causes a bit. But if you smoke, you're more likely to get colorectal cancer, colon cancer, lung cancer, uh,
a
throat
lot of other
cancer,
stuff. Yeah.
a lot of
Yeah.
other stuff before you get breast. Yeah.
Okay. So definitely reduce weight, reduce alcohol, and exercise is the key.
Yeah, because the fat actually produces similar hormones to what your ovaries produce, and this can stimulate a cancer to grow. Likewise, with your diet, if you have too much of a fatty diet, or you take a lot of processed foods like sausages, salami, all those things that are cured, they taste really good, but if you have too much of that, it is also not
Yeah.
good for you. And then exercise is good. You actually lowers your risk of it coming back. But with regards to alcohol, it was a long time coming out, this data, because there actually was a very huge lobby trying not to let it come out so fast. But all alcohol actually is bad. If you drink a little bit, so like 1 glass, 2 glasses a week, it does raise your risk a tiny amount, so much so that actually in the overall picture is probably still safe. Most women don't get any issues with that. Is if you drink regularly, and a significant volume, your risk of breast cancer actually does go up.
Doc, I
Yeah.
mean, we heard this, right? I mean, having a wine is good, but you see, the real
So it's
issue
good for
right
your
now is,
heart.
yeah, but what happens if someone is drinking 2 glasses a day
Too
over a period
much.
of 7 days? That's going to be a couple of bottles a week, even if he drinks 1 glass a day. So I think everything should be done in moderate. Anything excessive,
Yeah.
it could lead to be a poison.
Correct. So I think for most women, what is advocated as a safe limit would be two, maximum 3 glasses of wine. And just be very careful because if you have, what did they call them? Things like whiskey, cognac, those actually have a higher alcohol content. And so the volume that you can take, so it's not 1 or 2 glasses, it's a lot
Yeah,
smaller volume. And so just be
yeah.
careful. I'm not saying that you go teetotal, you don't have to stop enjoying it, but just practice some discipline and still enjoy it, but in a safe way.
All right.
Mm, yeah. And so this one actually is it's just a picture to illustrate what the risks
Mm.
are. So if you don't have any alcohol, you actually don't have much in the way of a breast cancer risk. 1 glass actually can raise it a little bit. So this is if it's 1 glass a day. 1 glass and a pint. So 3 to 6 units, you actually get 27 more cancers within 1,000 women. And so these are actually not small numbers. It's quite significant. Mm, yeah. Smoking, it can cause it, like I said, but it's actually a minimal risk, so it kills your body in different ways. But smoking for breast cancer isn't so big a risk. The other thing that actually can cause breast cancer is if you go on to hormonal tablets, particularly the hormone replacement therapy. So once you hit menopause, it's not so common in Singapore. It's actually very common in the West. But since all this information came out, even in the West, they've been cutting down a lot and they've cut down the duration for which women are allowed to take this kind of replacement therapy. And so that's why, actually, when we look at the rates of cancer in the Western world, it has dropped significantly. And that's because women have stopped taking these tablets for a long time. The key is 5 years. Try not to take it for more than 5 years, and then actually your risk don't really go up that high. So some women do need it because when you go through the menopause, it can be quite horrific in terms of the effects that your body may have, and so you do sometimes need this to just tide you over. Um, there are other protective factors which some people feel could be arranged, or stuff for others it may not be so easy to be arranged. But actually, if you have kids early, you have a few children, and if you can breastfeed them, this all helps. But it doesn't completely protect you because, yeah, I remember one of my earliest cases. She was her first child. She was a mother of three. Her first child was at the age of 18, and she still got breast cancer. But she was a lot older after that. So when that happened, but so it helps, but it may not completely help everything. Okay. So a lot of people feel guilty when they come down with a diagnosis. And then they feel, is it something that I've done wrong? And so a lot of questions I get asked, is it the bra I wore? And so the answer is no, there's nothing that you can wear that can cause a breast cancer. I did too many mammograms. This one actually is a real favorite because it means that, I cannot do mammograms then, I can actually escape from it. But no, the amount of radiation that comes from a mammogram is very, very low. And so even if you had one a year from the age of 40 until you're 85, you do not get enough radiation exposure to get a cancer. Okay, and so you actually get a lot more radiation just flying from Singapore to the US than you do from one mammogram.
Doc, we got a question for you right now. How
Yeah.
often should women do mammograms? Ultrasounds better.
Um, Actually, I would say mammograms start between the age of 40 to 45. And once you've got that one, if that first one is normal, do them every year, every 2 years is good. If there were some particular concerns which you may have to discuss with either your family doctor or your breast surgeon, if you happen to be seeing one, they may say you may need it every year. But on the whole, for most ladies, once in 2 years is sufficient. Ultrasounds, we don't really need unless there is a specific target that we actually want to look at more clearly. And that's when your doctor would suggest that you do an ultrasound scan. So by and large, we do not say that you need to do ultrasounds for screening, although it is more comfortable. And so a lot of women happily tick that on the health screening package, and then they don't take the mammograms.
And doctor, add on to that, also they call the self check. I mean, there are certain
Yes.
procedures that a woman can check in order to find out whether this lump will that be also be effective, because that is the first
Um,
level of examination before they see a doc. Or what do you think, they should visit the doc every, like what you mentioned and suggested?
I think that one is actually a little bit of a double-edged sword because I think on the whole, for most women, it is a good check because it makes you aware of what your breasts feel like, how they are normally. And so then if something were to change, you would be aware of it. And hopefully that would be what would prompt you to see a doctor who may then decide whether further checks are necessary. Okay. Um, if you look at all the information that's been published, actually, most people feel that doing regular checks don't really help in finding cancer earlier. And I think, but that's why I feel that it is not the intent that you find cancer earlier for the self checks, but I feel it's just to make you more aware of how your breasts normally are. And then so that you are better equipped to find that, oh, if you notice a change, and then that may actually then prompt you to come and do something about it. And that's the key thing, I think, just to be aware of how they normally are so that you don't overlook any subtle changes or things like that. Yeah. Yeah. The other thing is, remember, so a lot of ladies come and the first thing they tell me after we tell them they've got cancer, but I did my mammogram last year and it was fine, so I don't need to do any more. Mammograms only is like a photo. They show you what it is at that point in time. So they cannot predict the future. It doesn't, you need to do them regularly because something can always happen in the future. And it's only if you do a regular mammogram that it can detect changes that may happen in the future. All right.
Yep.
Um, some people are worried that because when you go into the mammogram, there is some pressure, and then if you have a cancer there, they feel that it will squeeze the cancer and then cause it to spread. No, doesn't happen. The cancer is a lot tougher than that. um, and then this one actually then goes on because then people feel that, oh, what if I do a biopsy, I'm poking the cancer, I'm causing it to have some damage, and then does that cause it to spread? And again, no, it doesn't cause it to spread. Okay, so these are all necessary investigations that we have to do in order to decide whether there is a cancer or not, but they do not cause the cancer to progress or spread in any way. And so it is completely safe. All right.
All right, doc.
Yeah. Another myth is that, oh, it could be antiperspirants, deodorants that cause the cancer. And the answer is no. The hair dye, actually, now, unfortunately, a little bit of information has come out about it. So if you dye your hair very regularly, and this would be every 8 weeks, okay, then you actually can increase your cancer risk. If you don't do it so often, or if you look at the chemicals that make it up, try and go for the more natural ones so that there's not so much of the chemical effect, then actually then your risk also will go away. Um, this one is also very common. People feel that taking too much milk, yogurt, cheese can cause it, and no, it doesn't. All right. Soy products. I don't know how come soy has such a bad rep for this, but
Okay.
no, no, no effect. You can drink
Is that
soy.
is that could be the reason, doc? Is it could be the reason because they talk about the genetically modified, food they are talking about right now, and what goes in? They're not sure. I mean, that could be
I
the another
suppose
spectrum.
so. I suppose so, but actually, my argument is, if you look at the Japanese, they probably have one of the lowest rates of breast cancer. If you're thinking about a really proper first world country that is quite fully industrialized and things like that, they consume as a lot of soya. Is in everything that they eat, and their cancer incidence is nowhere. It's certainly not like it is in the West, and it is at the most similar to what it is in Singapore, or possibly even a little bit lower. So no, you can go ahead and enjoy your soya milk. I think the main thing about soya milk though is the sugar. If you have too much
Right.
sugar, because it's very sweet, then that is not good. All right, but otherwise, no issues.
So
Yeah.
there is options to go for reduced sugar or less sugar, but unfortunately, the culture still have to come in. Like you mentioned, well, I mean, you mentioned about Japan.
Mm,
Agreed. You know, the Japanese love to exercise, and I was there in a seminar about 3 years back, and the way I saw them in a seminar group where I think the oldest one was about 85, 87. I think doing way much more better than me. So I think the kind of culture and habit I think they have following it for generations. So I
yes.
think that should be spread over to our part of area as
Yeah,
well.
that's right. I think it's good. I think one thing that COVID has really done for Singapore is that it has actually increased the amount of exercise that people have been doing. I see a lot more people exercising now than I
Yeah,
did before
that's right.
COVID days.
Okay,
I think the
everybody's
only
doing
one who
their
is the
exercises at
doctors.
home, so every gym has become a home gym.
Yes, that's right. People have, yeah, there's been very hot the sales of exercise equipment.
Yeah,
Okay. And so these are certain things that also cause people to worry. Doing implants, so putting in breast implants for cosmetic reasons, this doesn't make your cancer risk go up. It may make doing screening a little bit more difficult, but we can still do it. So don't worry about it. Some people worry that having too many abortions, because sometimes that happens naturally. You can't stop it. But again, it doesn't affect your risk of breast cancer. And for those who actually have problems conceiving, and then they feel that in order to get fertilized, you have to inject a lot of hormones that increases your risk. Again, the evidence is not there. And so it is still okay if you want to have children and you need to do it this way, it is safe. All right.
all right.
Yeah. I don't know how we doing for time. Do we have to stop and let you?
I think we have one more slide, right, Doc? If I'm not mistaken, because from
Ah,
40 we talked about one, right? Yeah,
yeah. Okay. Why don't we just go through this
yeah.
one? Um, so a lot of ladies feel breast cancer should run in families. My entire family is safe. We don't have a single one, and unfortunately, only 5 to 10% of breast cancer runs in families. The majority of cancers, the women who come to me, they are the only one who develops it, and so while breast cancer can be hereditary, it only is hereditary in 1 in 10. All right. 9 out of 10, it isn't. And so that's why screening is important. You need to go for regular checks, even if there's no family member with breast cancer. Okay. So do we want to? I think
Uh, should be good,
we
Doc, because right now, why is that? So, I mean, I got to tell you why. Because the questions that I have prepared, or we have prepared a few questions, and I think what the audience want, I think you have covered it very well in that slides, the PowerPoint slides that you have covered. So thank you, Doctor. Thank you so much.
no
Right now,
problem.
I have another speaker who's just going to jump in, and I think she has some questions as well. She's such a dynamic lady. She came to
Yeah.
Kopi events, I think, a couple of months back, and the amount of supports and friends and families was just amazing. A true life story that she went through, such a supportive family, and where she right now, and through the emotional period she battled it, and now she is with us. So let's invite Primala. Hello, Primala. I think you need to unmute your mic because we can't hear you. Yes, can you hear us?
Yes, can you hear us?
Can you hear us? Okay, I think you still have to unmute it. I think it is on um we can't hear you. Can you try?
Can you hear me now?
Yes.
Hello, doctor.
Thank you,
It's
Pramila.
Premila
Thank you,
here.
Pramila, for joining us.
Yeah. My name is Premila, doctor, and let me just introduce quickly on myself. Doctor, basically, I was having a lump while I was pregnant with my second baby. Okay. So, and at the same time, I was also breastfeeding my first son.
First job.
First child. He was almost 3, so he was so clingy. He was not really. I was not really feeding him, but he was latching on. Lah. There was milk. And when I first had it, I think it was about 7 months. And I went to my gynae and I told her I feel a lump. I think it was quite small, lah, like probably a hazelnut size. Yeah. So and when she scanned of course, we know some information, right? So when my father passed away out of, by the way, my father passed away out of esophageal cancer when he was 49. So I kind of know the malignant, benign terms, Also, when she told me it looks quite benign, and it did not have any out of shape tumor or something like that, right? So, but I was quite worried. Then when I delivered, the lump was still there. It was getting bigger, and I went for to her again, and she told me, "Oh, it looks fine, but if you want to do a biopsy, it's really up to you because you're milking and all." So she didn't give me a proper guidance, as of, I think you should or you shouldn't. She gave me a choice.
Mm.
So, and then she told me to come back after 6 months, and I started work, and the lump was getting bigger, but I still did not go because of the lockdown and all these things. I took it.
Mm.
I was quite complacent about it, lah. And then as I was pumping, feeding, and one fine day, I just realized there was a lump under my armpit, and I knew that it's game over, lah. Okay, so I said no, I have to go, and she told me that she will be operating in her clinic. Then I said, no, it's okay. I will just go to the right surgeon and I'll get it done. And then they confirmed that it was the doctor 99% in the during the ultrasound. She told me like, I'm sorry, but it is what it is. A
Mm.
biopsy is just to categorize it. So it was quite heartbreaking. And when I was categorized, it was HER2 positive, ERPR negative. So it's a bit on the aggressive side. I just told my surgeon, she's a very good. I just say remove my breast. I don't need it. If you need to remove my both breasts, just remove it lah. Fortunately, there was no spread to the other parts of my body, so it was only one of my lymph nodes were affected. In total of 18 that was removed. I removed the entire lymph nodes. So and the thing after removing, there was such a relief. But I also asked my doctor if you can remove the other one. Then she told me, no, 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 don't remove. It's not according to our protocol and all that. So I'm like this very freaking, I mean, very scared lah. And I'm still scared anyway. So I'm just trying to put up a smile here. But um, so I have a few myths that when I was like feeling that it was cancer, people say, "Oh, no way you can get, you're breastfeeding, you're breastfeeding, chances are very low," and so this kind of thing kind of blocked my mind. How can I get? So I thought it was like milk that I was massaging it, trying to get, try to see whether it's a milk, put hot compression la, everything, thinking it was milk. So
Mm.
then another misconception is also that when you scan, I feel like any woman who sees a lump or feels a lump, they should do a biopsy. Like they should not just stop at ultrasound, right? So I think doctors or surgeons or whoever should immediately refer them for a rather than giving us a choice, because we are in on the other side. We are their client, or their customer, right? So I think doctors also should emphasize on an immediate biopsy, whether it's a needle prick or a cut through, right? So mine was a cut through biopsy, by the way. So right now, doctor, I completed my chemo, and I did my radiation 15 cycles in between my chemos. And I'm on targeted therapy now. I completed 17 Herceptin jabs,
Mm.
and I've got one more to go.
Yeah.
So I have a few questions for you. My first
Sure.
question is, how often should I be doing mammogram on the other side of the breast? After my mastectomy, and I have done one PET scan after a year of from the surgery. So can you tell me a good solution for it, or answer for it?
Okay. The mammograms for the normal side, once a year.
Okay.
That's all you need. You don't need any more. For the PET scans, most evidence show actually that because you did have a little bit of disease in one of the lymph nodes,
Correct.
your oncologist may feel that they do want to maybe keep a little eye on things for the first couple of years. But
Okay.
if everything stabilizes and then each time the next one or two PET scans are normal, you can actually think about not doing it anymore. Um, what the
Okay. Yeah.
current evidence shows is that if we find it, um, if we find things too early, sometimes we may not have the necessary treatments in place, and then you would be left in a little bit of limbo because you can see something, then we think that we need to treat it, but we don't have anything appropriate. Okay. But
Okay.
that
Okay.
situation is actually changing.
Okay.
Um, and so this is something that, although we say now it isn't something that we would recommend, but there actually are quite a lot of advances in terms, especially for breast cancer treatment. And now that potentially sometimes, if it is appropriate, your medical oncologist, so this was the doctor who actually gave the chemotherapy to you, they may feel that, oh, with certain advances, it may actually be worthwhile doing a PET scan every now and then, because if we do see something, then we can start
Treatment.
like targeted treatment again, similar to what the Herceptin is. And that may actually then control things or even stop it in its tracks. And so, but
Okay.
this is a moving target. So at the moment, because our, how do you say, what we have to control things properly is not quite at that stage yet. So we aren't doing it on a regular basis. It's still not recommended that you do routine checks, whole body, to see whether the breast cancer has spread. Yeah, that's
Oh,
not standard.
okay. And doctor, tumor markers.
Yes.
What is
Uh,
here?
okay. Tumor markers are actually pretty good for certain cancers. Breast cancer isn't one of them. And even for the cancers where they are, in a way, counted as established, they're also not 100% fail proof,
um,
because you may have, like, even colon cancer, pancreatic cancer, these actually do have some tumor markers that are strongly linked. You may have the cancer, but they could still be normal. Okay. So, what most doctors would do once you have a cancer, and so for breast cancer, if you had it, we would maybe do a check and see what your tumor marker levels are like. If they were high, and then after treatment they dropped, then for you actually those are good signs, because it means that we do have something to track your cancer.
okay.
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 But it could be normal. And so if it was normal when you had the cancer and then it didn't change with treatment, then I'm not sure that doing it regularly actually would be very helpful for you. Okay.
Okay.
For many women out there, because now there's so many insurance screening packages and they always include tumor markers, you shouldn't be doing them. Because
Okay.
what a lot of us doctors see is that, oh, you get sent to a doctor because your tumor marker is a little bit high. So say the top band is number 25 and then you have 27. And then is that bad or is that good? It's like, no, it's probably nothing.
For
When
me,
we
it's like,
think about we
yeah.
think
For
about
me,
it
it's
in the
like
hundreds or thousands, you see.
correct.
But because it's above normal, firstly, the insurance company says, oh, it's not normal. And then
Okay.
that's a different thing. And then after that, but because you know it's not normal, then you worry about it. And then you end up having it checked maybe over a year, a few times, to see whether it goes down to normal. And then there's always a minor panic when, oh, it goes up again,
Correct.
then goes down again. Yeah. So tumor markers should only be done if you have cancer, because then it may be a good way of checking the cancer's progress, but not before. We
Understood.
don't have anything like that that's good yet at the moment.
Okay. Okay, doctor. Since I was expecting my baby and she is a girl,
Hmm.
and what do you recommend
For her,
for her? Yeah,
when she grows up. If you don't mind, can I just check how old you are?
I'm 34.
Right. Okay. You are actually a little bit young to be getting a breast cancer. And so first of one of the things that we would ask you to consider is to do genetic testing.
Okay.
Yeah. I also haven't asked, are there many family members who have cancer in your family, or are you the first one?
Actually, on my maternal side,
Uh-huh.
there is no one who has it or
Okay.
had it. Yeah,
Okay.
I'm the
Okay.
first. But on my
Okay. On your hmm.
paternal side, my father, he ended up with an esophageal cancer, and
Okay.
his sister had a mastectomy, but
Okay.
that was a benign tumor. Yeah,
Oh, okay. Okay.
very big
No, so
benign.
okay. You don't have a high risk family. All
No.
right. So correct. And so to be fair, your chances of this breast cancer in yourself being due to a genetic condition is probably not very high. But
Okay.
because of your age, it would be worthwhile just doing a screen.
Okay.
So this is the screen to see whether there is a problem in the genes. If there isn't, then as far as your daughter is concerned, firstly, she cannot get any abnormal genes from you because your genes are normal.
Oh,
Okay.
okay, okay, okay.
Yes. And so her risk for breast cancer would still be higher than the normal um, other women who, because of your own risk. She shares similar genes to you, and so that is what puts her at a little bit of risk. We would
Okay.
advise her to probably start doing regular breast checks from the age of 25.
Okay.
Um, she would be too young at the age to do mammograms, and so we would say she needs to start mammograms by the age of 30.
Okay. Okay.
Yeah.
Understood.
All right, now I
Okay.
have a question for Primala. Thank you, Primala, for
Yeah.
the question. I mean, you have came to
Too
our
many
show before.
questions.
Yeah. No, no, your questions are great. I mean, honestly. But what we want to ask you, and also for the viewers in front of Dr. Chan, when you are going through these, I mean, the medical science is always finding a cure for cancer, right? But of course, with medications, with chemos, and of course, preventives and screening checks are actually bringing the cancer a little lower. The markers are lower, right? But how is your mental state? How do you fight through this? I know you have spoke about this before about your families, your guru, your husband, your whole entire family, and I know your one of your friend also shaved, long hair together with you. But what you were going through and what is your message to people out there, especially for women who was going through this battle?
Okay, so I think Dr. Chan, you know how many patients come on a daily basis to the hospital, right? So likewise, every time when we just my dog, so every time um when just a minute, huh?
Okay, there was a dog.
Sorry,
Okay,
my
okay.
puppy. So every time we go to the hospital, or we pay a visit to the hospital, there is so many types of people and various types of cases, right? So like in the recent case, Dr. Chan, I have came across like the mother and both daughters were diagnosed in within a year. Yeah. So all two of them were actually receiving oncology treatment at the hospital which I'm taking right now. So likewise, the journey is not easy, Vance. Like it is,
Yeah.
even though I may appear very brave, or it is, every now and then we have breakdowns, and I can just cry sitting down and thinking of my kids, and it's not easy. But having said that, it changed the entire person of who I am today, lah, because it made me appreciate my life, and not to take chances of anything. And I became a vegetarian, and I don't take processed food. I don't take anything that could cause a reoccurrence, But beyond that, I leave it to God, lah, right, Dr. Chan? That's just somebody else that we have to believe in. So, what my advice would be to the people out there is don't take chances, and don't worry if you're diagnosed with breast cancer, because as what Dr. Chen said, there's so much advancement in technology and treatments. So the survival rates, and there's a better chance for everything. So for people out there who's listening or who would listen to this, just be more prudent, and keep your family members happy all the time, and give them good food. And for those of you all who have kids, I think we should start eating healthy from young, reduce sugar, and not too much of indulgence in fancy food lah. Mm, yeah, that's
Thank you,
all.
Primala. Thank you, Dr. Chan, for spending almost 1 hour with us. I know
No, it's my
we talked
pleasure.
about 45 minutes and 15 minutes of this and I think a lot of our viewers are enjoying it. It's an awareness, it's an exposure to understand about their own body that we live in. And I think this video will be recorded and it will be in our social media so that anytime anyone can actually watch it. Dr. Chan, before you take your leave, is there any advice or tip that you want to give your tips to viewers out there who are watching this right now live?
Um, I think just be careful, but you don't have to be overcautious. Don't be too paranoid, because then the stress will just go the wrong way. Um, do what you need to do. Do a mammogram every now and then. Sometimes you forget to do it every 2 years. It's okay. Do it in the third year. All right. But just do regular checks. Be aware of what your body is telling you. be aware of any changes. And if you think that these changes are not quite right, go and see a doctor about it. Most family doctors do know when it is a little bit suspect, and so they do push you to see the appropriate specialists when you need to. Um, but yes,
Thank you,
that's
Dr.
all.
Chan. Thank you so much for spending up with us this 1 hour of your precious time, and I'm really grateful for that. We will definitely will
Yes.
stay contacted, and we will definitely go for coffee virtually or whether in real when the situations get better. Thank you, Dr.
Yeah,
Chan. You can
let's
take
hope
your leave
so.
right now. Thank you.
Okay,
Thank you,
you're
Bye
doctor.
bye.
Thank you
welcome.
very
Bye
much.
bye.
Thanks. It was nice meeting you.
Nice meeting you too.
All right, Primala, that was Dr. Chan who spent almost about an hour with us. So now you are with us in the show. I know this is the second time you are coming in, and of course, oh, this is the third time. Oh, wow, that's good. Within a year. Thank you so much. I know, but you see, it is always very inspirational to invite people who have went through difficult times and challenges and obstacles to overcome it. That gives me inspired to to have the show every day. But with possibility, with the possible, we are doing it once every week. But Primala, just tell me, where do you get this kind of motivation? I mean, I do see you, I do follow you. Is it because of the love that is surrounded by you, or the well wishes that's around you? You have always been positive. You just mentioned that there are some times where you just tears will just flow, kanirgal, the tears will just come. But what is the thing that keeps you going?
Okay, I think it's just the spirit to live, lah. Once we have no choice, but we have to move on this life, So, and you have your kids, you have everything in front of you, and you just have to be brave. At least at least put up uh, a um, good face in front of my kids, But no doubt my son does understand that I have, because he can see physically I'm not normal. But once I just don't know what to say. It's scary, it's eerie, it's everything. But you just have to keep yourself occupied. I read a lot of books. I watch a lot of videos. I work. I've started working, so work is keeping me very occupied. And other than that, I play classical music now. I'm learning, so a lot of things that I just try to keep my mind occupied and not to take any stress. Yeah,
Pramila, I would like to say this. I'm not sure if is that the one you are doing it. They say that the mind is a devil's playground, but it can be also a God's playground. Because it is
absolutely.
what we are putting in. All right, like you said you were doing your prayers, you were doing all other styles. Your family was around. Your guru, especially your husband, is a supportiveness, the kind of supportive that he has given you. And you see, you have just becoming stronger and stronger and stronger in life as well, and also been தமிழ்ல சொல்லுவாங்க எடுத்துக்காட்டு an example for people out there to how to live positively. We do complain things for little things, when the bus is late, when the food is unhealthy, or when the food is taste not so good. We're saying the weather is hot, but we always want to put the spectrum, the other side of the area, that people do have a lot of stuff they don't have, the people who
Correct.
are in the other side, but yet people complains. But when an incident or when a strategy hits them hard, then they start to realize that, hey, then the whole world crushes. But you have been such an inspirational, and I'm always welcoming you for my show.
Thank
I'm
you.
sure there are many more shows that's going to come in. I know some of the viewers want it in Tamil. We will definitely will want to do it as well. And now, if you
Sure.
can look at it, there's so many people are sending their love and their messages across social media right now. It's the best way to get connected rather than saying negativity and seeing all that's not productive.
Absolutely.
You
Vince, I
know,
think there
you know
is a
yeah,
question for me. There is a
yes,
question for me on mammogram. How many times did I?
yes, okay, I got it. Yeah, please go ahead, Bimala.
Anis, I did not do mammogram because I think, was not recommended below 40 to do mammogram. So I did not do mammogram. I did not do any scan to my breast, except for the fact that I had the lump. Only then I did ultrasound, and then and a biopsy. Then, yeah. That answers your question, Anis. Yeah.
Right. So, Pramila, I mean, I know tomorrow is another working day. I don't want to keep you long on our copy advance. You asked the questions with
Too
Dr.
many
Chan.
questions, sir.
In fact, we love to have more questions, but just that everybody, have certain schedules, right? Um, and also yourself as well. I mean, you're also working. Pramila, any final advices? I mean, your tips and advices are always great for people who are listening this. You can either say in Tamil or you can say in English. Not an issue. Whatever you are comfortable, just pace around or you talk. You know.
Okay. So what I learned from before and what I learned from now is, in the end of the day, what matters is how we feel inside, right? So what is in the outside is just external. So we have to keep ourselves happy at all time, and whatever at all times, and whatever we say or do, we have to be very conscious la. Alla manasachi la. நம்மளோட மனசாட்சி தான் எல்லாம் காரணமே. So I did a lot of mistakes in the past. I did realize it now, and I have oath taken that I will not repeat those mistakes. And so, like what Doctor mentioned just now, like I did feel the feeling like, did I do mistake to myself? It all that will come when you're diagnosed. You feel like God is punishing you or something like that. That thoughts do come very frequently, but then you come to an acceptance terms that whatever happens is for a reason. எல்லாம் எல்லாம் நடக்கிறது ஒரு நன்மைக்காக நினைச்சு போய்கிட்டே இருக்கணும்.
Thank you, Pamela. I mean, you have spoken very well. Thank you so much for accepting my invitation for joining at Kopi events on a short notice to share your real life experiences as well. And for viewers out there, if you want to see Pamela's interview session in Tamil and in English, please visit over the past couple of videos that we have over since past 2 years. So, and Pamela has definitely have done almost three, including these three, right, Pamela? Three, right?
Yeah, three.
Yeah. So she done three. So more to come. I wish you all the success. I wish you all the best, Pamela,
Thank you so
for
much.
you, for your future, and for your family. And I would really love to see you again in the next Copy with Friends.
Thank you so much, Vince.
Thank
Thank you
you so
for
much, Pamela. I'll
having me
catch you
with you.
around.
Okay, bye
Thank
bye.
you.
Bye.
Bye bye. Oh, bye bye. Sorry. Catch you around. All right. That was a great talk session. Thank you to all viewers who have just joined, and those who had joined earlier as well. Thank you so much. Great messages are coming in for Primala as well as Dr. Chan, who talked about breast cancers issues and what to look for. And I think this video will be not. I think it is will be recorded and it will be in our social media, in our YouTube, Instagram. Sorry, not Instagram, LinkedIn and Facebook as well. We are trying to go into Instagram as well, but eventually, yes, it's on the pipeline. But the good thing is we are going into podcasts, so there will be a lot of podcasts coming in, so that you can just put it on and listen without any videos. That's going to be launched, and next Copy events will be a podcast as well. Thank you, viewers. So if you do have any questions, or if you want any topics that you want me to cover in health segments, please do so, because there's going to be a lot of interesting topics that's lined up for the month of December. In fact, the whole idea was to have two shows of in a month, but looking at the responses and the support and the viewers are asking around, and I think, you know what, let's have four sessions a month. So with the kind of support, Copy events, this is Vance, I will do what it takes. So thank you so much for joining me in Copy with Vance. I'll catch you again in our next show. For now, adios, amigo.